Hi, my name is Keri Reichart, and my theory was Adlerian theory. A little overview about the theory. Adlerian theory emphasizes on social behavior rather than biology. It's goal-directed rather than looking at the past and making this a present or future-oriented theory. It focuses on the fact that we make a view of our self-life, which is like we create goals that motivate the way we behave. This theory considers encouragement as a crucial aspect. They think it's an important thing in every treatment. They also do not see people as sick. They just see people as discouraged, so they don't come to therapy to be quote-unquote cured. The goal is not aimed at deciding for the clients that they should change about themselves. It's to help them through it. Adler also made a point of saying that people have choices, and he does not believe that your past determines your future. So a little history on the theory. Alfred Adler was a physician, he was a psychotherapist, and he was also the founder of Adlerian psychology, which is also sometimes called individual psychology. He was considered the first community psychologist. He pioneered the attention towards community life and prevention, and also population health. His theory focuses on human need and positive social change. He focuses also on the importance of feelings towards purity. He was also one of the first to provide therapy for family and group counseling. Some of the basic components of this theory are inferiority, which is basically hurting and or helping social interest. There's 3 subcategories within that one. It's biological, which is based on the need to form a group of physical survival, which is a helping aspect. Cosmic, which is recognizing death and limitations of human existence, which is also helping. And personal, which is feeling less powerful, able, or valued than others, or not belonging, and that is obviously a hurting aspect. Some basic skills for the counselor and client relationship is faith, hope, and love. You want to express faith in the client so they feel as though you are with them. You want to instill hope so that way they don't feel discouraged. And you want to show the client that you have a relationship, that you're there for them and whatnot. It's also important to have encouragement skills, which these could be active listening, empathy, communicating, having respect, focusing on strengths rather than weaknesses within the client. There are different approaches with this theory. One is that counselors try using this approach 3 different ways. One way is changing the doing of the situation. That is by helping the client change their present actions, and that allows them to feel that free feeling. The second way is changing the view of the situation, and that's changing clients' frame of reference. That may change the behavior, allowing them to see their strengths and show off their strengths. And the third way is evoke solutions. And that's basically just reminding their client of their abilities and their strengths, and that may cause them to change their behavior. There's also 4 different steps when using this theory. The first one is encouragement, and that's building a trusting relationship between the therapist and client. Always good to start out with. They have to agree to work together and effectively address the problem. The second step is assessment, which towards the end of this video I'll go into a little bit more. But basically, it's how the therapist has the client speak about the history, personally and their family history, their beliefs, their feelings, and what motivates them. And this will end up showing an overall lifestyle pattern for them. which might bring out some problems that the client didn't necessarily think that they had in the first place. The third step is insight, and the client ends up developing new ways of thinking of their situations. And then lastly, reorientation, and this is where the therapist will encourage the client to participate in effective actions and reinforce the new insight that you guys have worked out. There are some limitations within this theory, as is anywhere. There's a large amount of information needed about the family, so that could take up a good bit of a session or a couple sessions to really get the full background of a family. There's a lot of time needed to really learn this approach to be effective in it. Clients do not come in necessarily with a medical diagnosis, so sometimes that is difficult for a certain therapist. And counselors are not highly verbal, might not have as much success with this as others. Some strengths of this theory are that it's flexible. It allows the counselor to do what they think is best for their client rather than following an exact framework. It's also good that it's a very broad theory, so it allows for growth and development within the relationship. And a big strength is it can be applied to just about anybody, so different cultures and sort. Some weaknesses are that part of this theory, there's dream interpretation, which could be something very hard to learn for therapists and take a while, so that's a bit of a weakness. If you're doing managed care, it's pretty lengthy. It's not like a brief type of counseling. And another thing is some counselors like to make diagnosis within their sessions, and with this therapy, it's not really appropriate to make diagnosis. And lastly is technique. So before I had mentioned about the step 2, which was self-assessment, and that's what I'm going to break down in this technique that is used. Adlerian counselors use a lifestyle assessment, and in this assessment, they look at a couple different things that go into everything. One of the things is parenting style. So you look whether or not a kid was pampered or neglected. You can have just like birth order, which is the second thing you can look at. A lot of people might say, the baby is pampered, they get what they want, whereas the older child does not. And that's another reason why looking at birth order is important within this theory. Another thing they can look at is the early recollections. While they don't want to focus most of it on the past, bringing those early things that people remember really brings up of how they are in the present. And then looking at basic mistakes, when there's false goals, misperceptions of your dreams and what's reality, and just looking in faulty values. That is pretty much Adlerian theory. Thank you for listening. Have a good night.